So basically, we provide them with a folder the first time I meet them. We utilize something called 4R, which is a initiative that basically, it's a research initiative, honestly, where we provide kind of a framework of what are the next steps to this diagnosis. Whether that means, you know, PET scan, further workup, molecular testing, clinical trials, or, potentially are there social economic factors that we need to take into consideration. This sheet kind of starts the conversation and allows everyone to get on the same page in terms of what the patient needs. So there's that. And then we also provide, it's from the Lung Cancer Research Foundation, the LCRF. It's a really nice graphic and it's a worksheet almost. And I can work through it with the patient where basically when I see a patient, I always frame it. There's 3 questions we need to answer. The first is what the cancer is. There's a nice histology sort of guideline, and that has biomarker testing in kind of integrated into it with all the different molecular results that you could have. So that's a really nice segue into biomarker testing. And then the second part is they actually have a diagram of the body and the lungs with lymph nodes and whatnot. You can actually draw the second question, which is where the cancer is for staging, right, purposes. And that's there too. So they all get that, a visual sort of thing. And then at the end, we have a patient from Go-To Lung Cancer Foundation. We have patient information, a booklet for non-small cell and small cell lung cancer. And it's really nicely divided. And I can kind of go through and say, divided by treatment modality. And I can say, hey, read this part about chemotherapy, read this part about radiation. At home they have something to access, but it's, and I tell them to bring that folder each time because we'll make adjustments to it and we can always readdress, questions that come up.